Introduce Catherine officially, but she likes to go by Catie Becker. She's a pediatric nurse practitioner at Mass General Hospital. And Catie, she's going to be speaking to us about just that transition of care that when we have infants, children, they do grow older, which is wonderful. We want them to do that. But then they need to have a transitioning period when they transfer from the quotes child care to, going into an adult care space. So a lot of things need to happen, and Catie will give us an overview with what about this whole topic, I guess. And Catie, I'll let you kind of decide how you want this program to go. You can maybe mention if you want people to ask questions or wait till the
Okay,
end, and
sure.
I
No,
will
I
turn it
think
over to you.
I'm gonna just try to share. I have some slides, and especially, certainly people should interrupt and ask questions as we go. And so I'm gonna go over hopefully just some of the basics of transition of care. There's been a lot of um, growth in this area since I first started kind of thinking about it more, probably about 8 or 9 years ago. So I wasn't sure if I needed to do disclosures, but I always say, unfortunately, I don't have any financial disclosures. And so whenever I think of this transition from going from adult or from pediatrics into adulthood, I think about getting a new fish and putting in a fish tank. And the reason for that is because it seems like it should be this simple thing where you just kind of get the fish from the store and dump it into your tank, and really you can't do that. There are all these steps where you have to slowly put a little bit of water in the bag and then all these different parts so that the fish can survive when you make this transition. And a lot of times we think of transition of care from pediatrics to adults as being a one-time event, and it's just when you go to that new provider, but really it should be a process. And so I don't know, I wasn't sure what types of different situations people would be in, but I'll speak to my experience. So I've worked at Mass General for almost 15 years in the Leukodystrophy Center, and I'm pediatric trained, but about half of the patients we see are adults, and so we spend quite a bit of time on this. And then I often say that I also talk about transition of care honestly because I consider myself a transition of care failure. I grew up with a congenital heart defect, which is one of the early models for this whole transition of care, and I was lost to follow up for more than a few years. And so I tell patients that a lot of times because I want to make it to kind of normalize that experience, because I think a lot of times people are embarrassed by the idea of not following through, but it's quite common. And I think the other part of it is that a lot of the patients we see, we've seen since they were very young, and so we kind of are their safe place. And so the idea of finding new providers can be scary. But there are several reasons why it's important not to just stay in a pediatric based model. And that's in part because adults have different comorbidities. The disease characteristics of many leukodystrophies can change. So a lot of adult diseases can have more of a peripheral nerve component as time goes on. And then, of course, family planning, because all these are genetic conditions for patients that are going to want to have children. That can be an important part. And then in the US, and I'm sure in other countries, there are also these legal considerations. So in the US, it actually starts to change around 14, at least in Massachusetts, where you have different access to your kids' medical records. And then at 18, there's a big change where you have to have something documenting in order to have full access. The other important thing to note is that even if you're at a hospital like Mass General that sees kids and adults, where in the hospital you're seen might change. So if you were to be admitted, it can be a different floor. And so it's important to think that through because that can be a major change. Even for some of our boys with ALD, being on a different MRI scanner when you don't have child life can be an adjustment because you've gotten so used to doing one thing. And the big issue is preventing this bridge to nowhere, which is, unfortunately, at least in the US, is a significant problem where people kind of are just lost to follow up. So there are different ways to do this. So transitioning of care doesn't have to mean that you're changing your provider or that you're changing where your physical location's going to be. There's a good program called Got Transitions, which is a private, actually I think they have some federal funding, but it's a US-based organization that focuses on developing transition of care programs for different diseases. And so they have different models and toolkits, and you can get a different one based on if you're going to stay with the same provider but change kind of your perspective on what the care is going to be, meaning your budding adult is going to have different needs and becoming more of a focus, versus if you're changing total healthcare plans, hospitals, or just people. And so the timeline, so the interest in this need for transition of care is really quite new, even for the leukodystrophy world, which is new compared to a lot of medical history. And some of this early push was really because of diseases like cystic fibrosis and congenital heart defects, where people were, as treatments were better, were able to live into adulthood and do much better. And there was a problem with how do we transition, both with training providers to know some of these conditions, but also to establishing kind of transition plans. And a lot of the early ones were for more simple things like a heart defect, where you really are only transitioning one specialist. And it's in much more recent times, even 2020 and on, where there's been more focus on these more complex diseases, such as spina bifida and other ones that connect, I think, more directly to the leukodystrophies, but where you have a multitude of providers you're trying to transition. And then where sometimes you have this added issue of question around guardianship. And if children are able, I'm trying to use the word youth because that's what it seems to be the appropriate word, but I have a 15-year-old now, so I still think children is the appropriate, because she's clearly not anywhere near an adult. And so this was that simple model where you really had just the primary care provider, the one specialist, and then you're transitioning to one adult specialist and one adult primary care. And like I said, I failed even at this simple diagram. So you can imagine for our kids, it's usually much more complex. And one of the biggest ones is how many school-based services kids get. And I can't speak to other countries, but this is a major problem for a lot of the kids I see, because we in the States have so many services that are school-based, and then there's not a clear transition to who's going to provide those services in the adult world. And then obviously things like health insurance and legal questions, and even just where you can live. And so hopefully this can be of some help. I saw the word guardianship on the original title and got nervous that I wasn't going to know all this legal stuff. So I'll tell you the little bit I can tell you. The experience I have is really with filling out the forms for people. But if your child's in the US and they have an IEP, by the time they're 16, there needs to be some type of transition of care plan as part of that IEP. Most children can receive services through the school system until they turn 22, and then it can be complicated. And we've had kids that are transitioned to adult in all different situations. We've had them where they're staying at home and living with their parents, and their parents are able to care for them. We've had ones where, if the parents have increasing medical issues themselves, we've had people live in assisted living type home-based programs, adult foster care programs, all different types of settings, but it's much more complicated. And so this is not legal advice, but it is important to remember that at least in the US, every state has different rules. So exactly what you have to do for guardianship can really be different. And you really want to meet with a lawyer as you're getting close to that age. Even topics such as who's going to be your guardian and having two guardians instead of just one. We recently had a family where the parents were the guardians, and as they were getting older, they wanted to make one of the adult siblings a second guardian, and it was had to be a whole nother legal case, and it was um, much more complicated than it really should. And so, if you decide that your child does need to continue to have some type of guardianship, again in the U.S. at least, it's important to meet with that lawyer, and then it's also important to have updated neuropsych testing. So we need to have on the paperwork some way of qualifying why we're asking for this, and they typically want to see some kind of solid, concrete numbers. And then the other part to know is that in all the cases I have been involved in, they also really want us to be able to point out areas where the adult now can do something. So even if someone needs really quite extensive assistance, are they able to help pick out what food they want or this kind of thing is another part that they tend to want to see. Um, and so, and then the final piece I'll say is it can also complicate some medicines in the US at least. So certain medicines that we use for behavior modification can, unfortunately, in my opinion, require some extra documentation if they're considered an antipsychotic, even though we're not using them for that reason. So it's definitely one of these things that you want to start early. Don't wait till the month before someone's birthday. So I just wanted to refocus back on this timeline, and again, pointing out that it was really, and it's interesting that 2020 is when this first publication was made for chronic conditions, because that's also when MGH decided to start our transition of care plan in clinic, which unfortunately was largely derailed because a few months later clinic became fully virtual. But we did have a few months where we did the plan that I'm going to show you, and then we're working to get back to it. And I wanted to make sure there were quite some resources in here that people could go to for additional information. And as I was doing that research, I was happy to see that it was just in June of this last year that there was a formal recommendation made to our national health program about how states should be working on this transition of care. And so a few things that they pointed out was that right now there's no formal way for any of us to be giving feedback. So it's very hard to know how many kids are being lost to follow up, how many kids are having nice transitions. It's also not financially covered. So, for example, at Mass General, I know the Diabetes Center has a full program that families go through of where a social worker teaches them and makes sure each kid has a really clear plan. But all of that is currently through grants. And so they're trying to make it so that the insurance would help cover some of that, which I think is actually quite important because it can save you so much on the tail end if you've done a good job that you're hopefully not going to have hospitalizations. And then identifying which agencies are going to be responsible for these services. So it's not something that I think it's something that often in many hospitals when it's talked about, people get nervous because it is very overwhelming to try to even just identify providers that are willing and capable of taking on these more complex kids. But I think hopefully this is going to be a bigger and bigger problem as we come up with better and better ways to help these children with leukodystrophies, and they're going to do better and better into adulthood. So I just listed a few links that hopefully we can share with you. Autism Speaks has long-standing had some very good resources on the legal side of it, and they have, at least for the U.S., different states, and have a new, to me, I think it's been published in the last 2 years, quite extensive handout on transitioning really more globally with how to help children find employment in different type of situations and self-advocacy. And then there are also the spina bifida guide, and then for children with disabilities. I think the spina bifida guide also is quite good because those kids also need oftentimes many similar services to leukodystrophy kids because they can have bladder and bowel symptoms that a lot of our kids have. One difference can be cognitive and mental health things can be a bit different. At least I have much more limited experience in spina bifida. And so this is kind of my wish list of what I want the transition for our leukodystrophy centers to look like. I can't say that this is necessarily what it looks like today, but I'm hopeful that this is what it will look like. So if we look at the transition of care from that gut transitions, this is kind of the guideline that they suggest for how to set up your program. And so you can see it starts really young at 12 to 14, which is, I think, startling to a lot of people. When I first started, I think the first time I gave this talk, my daughter was about to turn 12, and I was like horrified at the idea that I was going to have to be thinking about transitioning her medical care. But it is important because we're trying to make it a slow and easy process. And so the first part is having a policy and guide. And the way we did this, in 2020 before the world shut down, was we had a form we could give families that explained why we were going to do this. And I think many families, it's nerve-wracking. I've had even families that have had young adults be very nervous about their children going in the room with us alone because they're afraid, I think, of what we're going to say. Are we going to, maybe it's just they're scared of me, but we have had families where I think you've spent your whole life taking care of this child with special needs and being careful of what you say and being afraid of what is going to happen if you're not in the room, which I understand as a parent that that's a hard thing. So I think it's important and that we also make sure it's clear to people why we're doing this. And so in the age of internet, it's really important to remember that if your child is able to go to school and Google it all, they're gonna find all sorts of stuff, just like many parents Google. And I will never forget a patient. I used to treat a lot of neuromuscular diseases, and a Duchenne kid came in and said, don't tell my parents, but I looked up Duchenne and I have these questions, but I don't want them to know. And so I think it's really important to create as much of an open conversation about it, because if children are able to Google, you can't protect from what they're going to see because they have computers and stuff so early. And then within the hospital, there's supposed to be a tracking and monitoring. So the programs that are more developed have ways to track in the chart where you are in this transition of care and how it goes. And so the way you do it, and this is really hard for leukodystrophies, and so about a third of the patients that we see have adrenoleukodystrophy at Mass General. So at first pass, we did this for ALD, just because the leukodystrophies can be so diverse. The plan was to try it with one disease and then try to make this more universal. And I will say that I have not done a great job at following through with that second part. But so basically you meet with the child and you give them a basic questionnaire, and this is the part that's hard, but I would love to think through with other people how we could make this more universal. And it was amazing to me how many kids really didn't know a lot of the words, because I feel like they've been in the room every year, every 6 months, for many of them now I've seen for 10 years. But I think that for these leukodystrophies that have clear interventions, we work really hard at saying you can do anything, you're gonna be okay. And sometimes we forget yes, as long as we do these different steps. And so after you go through this, then the kid helps you come up with some goal. And I was also surprised how many of them had goals. Like, I want to know how to request my medicine, or I want to know, it's very small, simple things. And so these are just some general ideas of things. Working on knowing your own medicine is very important. In my general neurology life, especially if kids have seizures, it's a major problem if they haven't been taught how to know when they need a refill and suddenly stop having the medicine is a significant problem. Understanding like when you would need to call your doctor, what is something that would be a reason to call, and then having physical plans for things like seizures and adrenal. And I think this we're better at, because if kids are going to a school setting, you have to have some type of plan usually for these things anyway. And then this, I was, you know, again, I was reading through some of the updated data the last 2 weeks, and different ideas about how to think about this in a larger sense, and even just having more independence overall is important, because we're trying to teach them how to self-advocate. And for many people, being in a hospital setting, I think it's even harder to self-advocate than it is in regular life, because people, you know, get nervous when you go to nobody really likes going to a doctor appointment. So I think remembering to practice some of this in regular life is important. And then the final step is what I think most people actually think of as transition of care, is finding who your providers are going to be, and then having that appointment. And so the final step, where you're kind of finally swimming along, is people usually use the term friendly handoff. It just means that your providers have some way of talking to each other. Some centers, I don't know that any leukodystrophy centers do this, but some cystic fibrosis or diabetes and cardiac centers that are longer established will have like a joint appointment where you go in and see both the adult provider and a pediatric provider at the same time. And one of the problems with that has been that both people can't bill, which is, you know, just, I guess, a fact of life, is that can become a barrier. So I think having some conversation about that on the insurance side is important, that that's begun to happen. So to give you a sense of our center and why I think this is important. So about half of the patients we see are adults. If you look at ALD, that's about a third of our patients, and of those, about a third are in this transition period. The other adults we see are a mix. We have some adults that have known they've had or have a childhood leukodystrophy that have grown into adults, and then we also have a number of adults that have an adult onset leukodystrophy, which is obviously a different. But if we look at these adults to try to get an idea of how well we're doing, it's quite eye-opening that this is something that there's a lot of room for improvement. So the first thing is that anyone that has an up-and-coming adult, there are very few adult leukodystrophy centers in the country, and limited experience. So Germany, I know, has some good experience in adult ALD transplants, far more than has been done in the U.S. There are a few, I think Mayo has a leukodystrophy center. There's one at HUP, but there are very few adult programs. At MGH, Dr. Eichler and I have followed adults, but both of us are pediatric trained. So I did not get permission to put her picture up here, but Dr. Lee is our current fellow, who's going to be, hopefully in the next year, opening up her own adult leukodystrophy clinic. And she is a gene therapy fellow, but she's the first adult-focused. And so I think that's been fabulous. And I think some of the problems with this is this lack of testing in the adult world. But even if we're looking at just kids with transitioning, the psychiatric part can be really, really challenging. So kids can have all sorts of behavior problems, and they still tend to have a support network. Whereas as people transition into adulthood, it becomes much easier for them to kind of isolate themselves. So many of these conditions result in some impulse control, even some like inappropriate sexual type comments as I want to say as the men, but I'm biased because we see a lot of excellent leukodystrophy, so that's more men. But those can be really hard to then find people to stick around, and it's finding that support network is much harder, and even finding like an appropriate day program, because a lot of those programs are going to be people that are much older, and so some people that's not so helpful for. So it's a tough time being in that early 20s and 30s, I think. This is a one of a patient that I do have permission to share that I don't know if many of you know. His brother Ken Diefenbach is very involved in the ALD community. But his brother was a patient of us a number of years ago before he passed away. And um, and so he was also lost to follow up. And so again, as I mentioned, these patients can be different than the kids that have or not just, but have something like cystic fibrosis, as we have vision and hearing and cognitive things that make it more difficult a lot of times to find this transition of care. And so I just wanted to highlight that the fact that there's a change in symptoms, and I think this is going to ring true for more of these diseases that have interventions where you see these peripheral nerve problems, which take more time to fully develop. And so the real problem is this being lost to follow-up, and so the chair is just empty, where we don't know what happened to the people, we don't know what services they're getting. So in the U.S., this is the newest data I could find. You can see, so this chart is just showing you what percentage of adults versus children have no care provider, no primary care, no specialty care, nothing. And so you can see it's almost 30% of U.S. adults have absolutely no health care providers, so they have no one that they're seeing. Whereas for children, it's quite low, and in certain parts, it's even lower.
If you don't want to, I will. It's fine. Rain, are you ready?
Oh, I think Christy doesn't realize she's unmuted. And so you can see that this is not just within our population. So in our clinic, and so this is men that are being seen in clinic, the amount that are getting their recommended MRIs is less than half. And so obviously the number is going to be much lower because these are people that are still coming to clinic. And whenever I bring this up with parents, almost every parent says, that's not going to be my child because I'm going to make sure they go. I'm going to force them to go. And unless your child is going to live at home and you're their full-time care or primary care, then I think, yes, that can be true. But it's not really what happens for kids that are able to be more independent. And so I always say, well, does your parent know the last time you went to an appointment? And so as adults, we tend to not be nearly as good at this preventative care. And so in our data, and this was what really kind of was like a slap across the face to me, of the men we saw, so adrenal leukodystrophy, you can have this cerebral form of the disease that we know how to treat, but only if we catch it early. So in childhood, with newborn screening, we have no patients that are presenting with advanced disease that we knew had ALD because they're all getting their MRIs. Our compliance is in the high 90s. Now, the adult form of cerebral disease is more rare, but of the men that we had seen when I pulled this in 2023, there were 12 men we had seen with advanced disease, and half of them had been known they had this disease and just had not had MRIs in many of them 5, 6, 7 years. And so I think this is, I don't think this is probably just unique to our center. I think this is something that we really need to think about as newborn screening has come online for diseases, how we're going to make sure that we don't allow this to happen. And so Ken, the man that I mentioned before, put on their Facebook group kind of asking, why are you not going and seeking care? And I kind of thought maybe some of it was going to be an insurance issue and that it was expensive. And really what was said was a lot more of what my lived experience had been personally from my lack of follow-up, where these men have grown up with this disease and their MRIs have been fine, and so they think it's probably going to be fine, I'm not going to go. And that kind of actually doing well for a long period of time makes it a lot easier to get lost to follow-up. And I think some of it also has been we're not very good at treating a lot of the symptoms of adulthood. We're not good at having interventions for even more advanced disease in other leukodystrophies. It's an area that's lacking, and so it makes sense to not want to come to an appointment if they're just going to talk about what's difficult and not have solutions, but the only way we get solutions is if we see patients and can understand these things better. So this is kind of my hope for the future, is that all together we're going to be able to have a better system for care for the adults with leukodystrophies. And I think it's going to become very important, because I think these kids are going to do better and better, and more of them are making it to adulthood. And so I hope that the transition to care will be able to look like that more simplistic method, but it's just that all those services they need will be captured in the one center. And that is all.
Thank you so much, Catie. That's a lot of information. Um, all the best to everybody. Thank you once again, Catie. I
Bye,
appreciate
thank
that.
you.
Thank you.
Bye for now.